want to welcome all of you for being here. My name's Chuck Daigle. I'm the CEO of Ochsner LSU Health. Great day to be here. Today we're truly recognizing a monumental effort. It represents the best in our country, our state, our region, a true collaboration of parties coming together, state officials, the National Guard, healthcare system, medical school staff, a true collaboration of all providers as well as government officials to take care of our community. It was only a month ago or so that the governor and his administration contacted us, Dr. Ghali and I, to look at surge capacity and what was the potential that we could add additional ICU capacity as well as medical surgical capacity to our community in North Louisiana. Obviously, this is very important as we've looked at the models and the graphs in terms of healthcare delivery, the spread of the COVID-19 virus, and want to make sure that we are prepared to defeat that virus and to provide the highest quality of care to our patients. Many of the people that you see here today have had a huge effort in bringing this together. Really, our plan was to create 77 additional ICU beds at the Academic Medical Center on Kings Hwy, the Ochsner LSU Health System. And by doing that, creating 77 additional ICU beds, which will get our ICU capacity up beyond 150 ICU beds, the plan was to move our 4th and 5th floors, our labor and delivery suites, our antepartum, post partum, pediatrics, pediatric ICU, and neonatal intensive care unit to this beautiful campus of St. Mary's. Really, so to modify this campus, campus is in great shape, and to move that 4th and 5th floor here. So the monumental effort here going on is that in a quite short period of time, modifying this campus to house all of Women's and Children's Services for the Ochsner LSU Health System, and in turn be able to provide an additional 100-bed ICU capacity at Ochsner LSU Health. Obviously, I want to thank the Honorable Governor John Bell Edwards, Mayor Adrian Perkins, all government officials that have really come together to work to put this project together. And I want to thank especially today these 50 National Guardsmen, the men and women that have volunteered to help us move all of our equipment, all of our patients. Not only do they serve our country, and we owe them a great debt of gratitude for that on a daily basis, but to step out in this effort and work for us in order to safely, adequately move equipment, move patients is a huge effort, and we're very appreciative. Over a week and a half ago, they stepped up very quickly and got into the mix, really orchestrating in a very configured fashion of how to do this in a very methodical approach to make sure that, again, equipment and patients were moved in a safe and efficient way. As such, on behalf of the Ochsner LSU Health System and being a citizen of our state and our community, I want to thank each of you for the difference that you're making in our community to take care of our community, but also our patients within Ochsner LSU, as well as all of the health systems. Want to a big shout out to Colonel DeMoro and his leadership in deploying this entire group as well. Everything we do at Ochsner LSU is because of collaboration between two partners, Ochsner and LSU. Both organizations have incredible skill sets in terms of running healthcare delivery systems, teaching and training medical staff, bringing the best medical staff to a given region, and obviously we have that today. Obviously leading that effort at the School of Medicine here in North Louisiana is Dr. Golly, and would like to invite Dr. Golly to say a couple words.
Thank you, Mr. Daigle. It's my honor to be here today, and I want to welcome, on behalf of LSU, everyone here. And I would like to certainly thank all the folks that are on the dais as well. I'd like to briefly, from a historical standpoint, just acknowledge Mr. Daigle mentioned this beautiful campus, and again, I want to acknowledge the sisters here, the Catholic Diocese and Christus Corporation for donating this property initially, and Mr. Stephen Wright back in the spring of 2016. I also would be not in line if I didn't thank St. Mary Place Properties and Bill Comegys, Ray Lassane, and Matthew St. Amant, who sort of trusted in me and took this property into that foundation in the summer of 2016. And certainly, I'd be remiss if I did not thank the Ochsner LSU Health System of North Louisiana Board of Directors for their continued support of this project and this mission beginning in the fall of 2018. As Mr. Daigle mentioned, the governor was instrumental. I can remember hijacking him and bringing him here in the spring of 2016 when that wasn't the reason he was in town. I brought him here and I said, Governor, look at this property, and we just can't let it go to waste. And certainly it hasn't gone to waste. It's been put to great use and will continue to be put to great use. I also want to thank him again for reaching out to us when he rightly noticed the need for a surge in North Louisiana and the expansion in that area. And again, I want to thank him for agreeing to have the National Guard support this mission. Finally, I want to thank all the folks that make what I like to call Operation Surge. I want to send a shout out to Mr. Madden. I don't know where Tommy is right now. Tommy's over here somewhere. Tommy, I'm talking to you. Tommy really has helped tremendously in coordinating all the different agencies that are involved. This isn't just a switch. I mean, it's a coordinated effort, and I want to thank Tommy for making that effort and helping coordinate all those different agencies. And I want to thank the National Guard. I'd like to read a statement, if that's okay, to you, sir. Colonel Desmareau, commander of 256th Infantry Brigade Combat Team, and your most capable group of men and women. On behalf of the state of Louisiana and its citizens, I would like to thank you all for your tremendous and rapid support of the needed expansion to deal with this COVID-19 crisis. The people of our great state will surely benefit from this additional capacity. Thanks again, John Bell Edwards, Governor. Congratulations, Colonel. Thank you. I'd like to at this time introduce the Honorable Adrian Perkins, Mayor of Shreveport.
Good morning. Happy that we were all able to come out today and celebrate some good news. Lord knows that we do not get enough of that today. The COVID-19 has tested our community in unimaginable ways, but I am proud that Shreveport has stepped up to the occasion, and I am confident that we will continue to do so. We have been able to adapt and respond because of our world-class healthcare systems, our world-class healthcare workers on the front lines fighting every day, because of our heroic first responders, those firemen and police officers that are on the front line every day, and our other city employees that make sure that our water is running and our sanitation and our trash is being picked up. Today I want to thank the National Guard and Colonel Desmareau for stepping up as well and assisting us and supporting us with this very, very critical mission. As I look at the crowd and I see these soldiers, it's taking me back down memory lane. I was in a cavalry troop myself fighting another war some years ago. So I want to thank you, especially thank you all for what you're doing here. This mission will increase our capacity to treat not only Shreveport residents, patients, but patients from throughout the region, requiring intensive care and saving lives. The pandemic has sped up the timetable So this mission has become much more complex and has required a lot of communication and coordination amongst various agencies. The National Guard, the state of Louisiana, the city of Shreveport, LSU Health, and Ochsner are all working together to safely relocate patients and increase the number of available ICU beds in Shreveport. I also want to thank the men and women of the Shreveport Fire Department. They will provide 2 medic units in transporting infants and babies in ICU. Shreveport Fire Department is called to emergencies across the state and nation all the time. Just last weekend, they were in Monroe assisting with search and rescue mission after the tornadoes devastated that community. This mission is just another example of them answering their call to serve their community and the communities around them. In closing, we all know that these are very, very difficult times. Everyone is making sacrifices, and I'm so inspired by the acts of courage and selflessness that we are witnessing every day. From the doctors and nurses to the grocers stocking shelves late into the night to each and every citizen who is doing their part. Please hear me when I say that we appreciate each of you. It is because of you that I know Shreveport will come out of this crisis even stronger than before. Thank you, and now I will introduce Colonel Desmoreau.
Thank you, Mayor Perkins and Mr. Daigle, Dr. Golly and Dr. Lewis, members of the media, but most importantly this morning, the soldiers, the 2nd of the 108th Cav. It's moments like this that truly remind us of that special relationship that exists between the Guard and our community. These soldiers in front of you are the sons and daughters, are the friends, the students, and their employees of this community and of our state. And we have all had this experience of the love that this state has for its National Guard. Even before this COVID response, anywhere as you went in this state in uniform, you would be stopped and you would be thanked for your service. We are always honored when we're given the opportunity to truly earn that appreciation that this community gives us on such a daily basis. To the staff of Ochsner's and to the LSU Medical Center, I thank you for giving us this opportunity to assist in expanding your capacity for care for the citizens of this community. And we know that with every additional person that you care for, that we will share in that success, and we'll have that for the rest of our lives. So to the soldiers of the 108th, your dedication and willingness to serve humbles me. You represent everything that is right and everything that is good in today's Guard. Thank you for all that you do. Sound the charge. And I will now be followed by Dr. Lewis for closing remarks.
Thank you, Colonel. Hi, my name is David Lewis. I am currently the Dean of the School of Medicine at LSU. I am also the System Chief Medical Officer for Ochsner LSU Health. And also, by training, I'm a high-risk obstetrician, so this building becomes very, very important to me. Colonel, I am just in awe of your group. They descended upon Kings Hwy earlier this week, and they have moved an enormous amount of equipment and done it seamlessly. And I can just tell you that I am proud to be an American, sir, and thank you for your service. I'd like to thank the Ochsner LSU team that has come together, and over the last 5 to 6 weeks, a group of people have worked night and day to make this possible. Opening a hospital in a short period of time is not an easy undertaking, and people like Meg Allen and Riley Waddell and a number of other people have just made this very, very seamless, and I want to shout out to them and thank the entire group. This building will continue to provide the highest care that we're currently providing at Kings Hwy, but more importantly, it really gives our organization a big boost. This is a much nicer facility, so the women who seek our care will come into a very, very nice place, but more importantly, or just as importantly, the children, the NICU and the PICU, as well as the pediatric floor, is state-of-the-art and just a wonderful building. I also want to give a shout out to the group over at Kings Hwy. We have a number of patients that are very critically ill with this virus over there, and I can tell you that our group is working night and day to make a difference and save lives, and I want to give a shout out to them. And so with that, I think I'm going to end this and see if there are any questions. Thank you.
Mayor Perkins, with this effort today, does you think that it will help reopen business here in Shreveport?
Well, I don't know how it speaks directly to the economy right now. What we do know is that, given worst case scenario, that our hospital systems have more of a capacity to treat those that are in intensive care and those that need that life-saving care. We hope we don't get there. And obviously, if we're at that point, our economy is not going to be open. But it's kind of worst case scenario prior to the steps of us thinking about reopening our economy.
Dr. Golly, can you give us a bed count and how many do we expect? And do you see the curve flattening, or what's the current status?
Right. So, I mean, there is indications that the curve is flattening, and that is directly related to the mitigation efforts that each and every Louisianan is doing. You know, the washing your hands, keeping a 6-foot distance, staying at home with the governor's order, all of that is resulting in a flattening of the curve. Now, we may be a week or two behind the southern part of the state relative to the flattening of the curve, but all indications are that the curve is going to be not as high up here and that it's going to be dissipated over a period of time. But that is 100% related to the efforts of mitigation that have been put into place through the governor's office and what every single man, woman, and child is practicing here in the state of Louisiana. So I can tell you, you know, we're number one in the country in number of tests per capita that's being administered right now. We need to get a hold of that. That way we're going to be able to do the tests, whether they be viral testing or whether they be antibody testing, and we'll get a better picture of what's going on in the community. We get people back to work quicker. The economy gets kick-started quicker that way.
Do you see that we might be still mitigated at home for another week? What do you see?
Well, definitely for another week. You know, the governor's orders through the end of the month. His team is currently working on. His task force is currently working on seeing whether there'll be any additional mitigations beyond the end of the month. As you can see, he's already done partially that with the school not resuming until after the school year is completed. So there's already measures that are being put into place. But you know, to answer your question, yes, it's definitely going to be through the end of the week. There's some thoughts about bringing some less urgent surgeries back into the realm and kickstarting our economy and the hospital that way. And you know, to answer the question that they gave the mayor a minute ago as well, the OLHS and the Health Science Center are two of the largest, along with Barksdale, two of the three largest economic drivers in this community. So if we're going to be able to expand here, that's going to expand the economics of this community. It's just going to take a little bit of time, but yes.
What about ventilators? Are we good on ventilators?
We're good on ventilators.
How many do we have, or do you have a number?
I don't have an exact number for you right now, but we've had enough that we've been able to send some down south and over to Monroe. So we have plenty of ventilators. It's not an issue.
Dr. Golly, is the transformation of the hospital here, is that temporary, or is this just kind of going to be after?
No, this is permanent, and this was actually part of our original plans, was to do this over the course of 20 to 24 months. But when the question came about the surge and the governor said to me, we need some help with that, this was the best place to really move the non-COVID patients, because the COVID patients are of generally a higher acuity requiring ICU care in an adult ICU setting, which we currently don't have over here, but we do have over there. And being a level 1 trauma center, we can't really afford right now to divide our personnel resources. So the personnel are there that can take care of them, and that's why we've taken certain services out of there and brought them over here. But the intent is for this to be permanent and to grow and to expand. Yes, sir. Thank you.